A 40-year-old African-American female presented to the hospital with cough, fever, and night sweats. She said this has been ongoing for the past week or so. Chest x-ray done in the ER shows bilateral hilar lymphadenopathy. You started her prophylactically on antibiotics and admitted her to the hospital. What do you think about the diagnosis? How would you confirm your diagnosis and how would you treat? So this is pretty interesting because this always gets me every time. A patient comes in with cough, fever, and night sweats. What is the first thing that you could be thinking about? TB, right? TB presents with cough, fever, and night sweats, right? That's the most common presentation that happens in any test. And when I have a patient that comes in with this, I either think of this or cancer, like TB or cancer. Night sweats always comes in with cancer or TB. So this has been going on for that long, but the chest x-ray shows bilateral hilar lymphadenopathy, so at least it doesn't show some sort of a mass. And this is usually very classic in tests, and sometimes they show you the picture of the x-ray and tells you what is the diagnosis. So when you see a patient who's 40, African-American, bilateral hilar lymphadenopathy, you got to think about sarcoidosis in the back of your mind. Sarcoidosis is a multi-organ granulomatous disease. What does that mean? Multi-organ happens in a lot of organ. Granulomatous causes granulomas. It's a disease. So what is a granuloma? A granuloma is an aggregation of macrophages that form clump together driven by the CD4 cells. Where else did we talk about CD4? HIV, right? That's the one we actually follow with HIV and AIDS once it drops below 200, So CD4 is the one we talk about with AIDS and HIV. So CD4 is the one that drives this immune reaction to cause macrophages to clump together and cause what we call a granuloma.